Okay, so this exercise is going to be a sit to stand exercise. The goal of this is to focus on being able to get this pelvic nutation or this tuck. So we're looking at really focusing on trying to pull the pelvis down with the hamstrings and the glutes and lift the pelvis up with the core. You're going to start in that position. So you're thinking about feeling that little bit of stretch or pull down through here, maybe a little bit of pressure through the feet. You're going to lean back ever so slightly, just increase that amount of stretch. And then you're going to very slowly just bend the knees to come sit back towards the heels or as low as you can get. Okay. Once there, take a breath in, press down through the balls of the feet here to start to drive up and immediately start to tuck the pelvis, pushing the pelvis towards the wall in front of you, thinking about that lift and tuck and really focusing on feeling the glutes and the hamstrings activate. Once again, lowering back down just a little bit, a little stretch, and then gentle lower, trying to get both sit bones to hit the heels at about the same time. Right? And again, tuck, press, drive. Feel the squeeze. Slightly lean back as you hold that squeeze, right? So that's getting some really good activation here and leg through the front. And then we're coming back down nice and slow, bending the knees. Okay. All right. So this exercise is for hamstring activation and glute extension from two different positions. So we're looking at a long leg and a short leg. So you're going to lay down on your back. We'll have the left leg up to start here and the right leg out. So we're looking at trying to get long leg activation along hamstring glute activation to the right side. And then we're looking at trying to get hamstring activation and glute activation to the left side here. Take a big deep breath in. Press the left leg down into the ground first. You're going to feel the hamstrings automatically engage. You're going to tuck the pelvis a little bit, and then you're going to press down through that heel of the long leg to just get a bear hover off the floor. And then we're going to check in with that pelvis to make sure that we're not dropped from one side or the other or hiked up in any which direction. So go ahead and put your hands on your hips. Give a good check there just to make sure that everything is lined up. And then pressing down through that heel, pulling those toes up, locking out that knee, and pressing down through that left leg here, holding that little bit of tuck, and really feeling the hamstrings engaged. So we're going to hold that for 3 breaths to start. So focusing on the press. And on the exhale, coming down nice and slow. Good. So you'll alternate sides here. So we'll go and switch, coming over to the right side, pulling the toes up, pressing down, driving through the heel of the left leg, pressing down to the right, checking the pelvis, finding that tuck, and then breathing. Really focusing on the downward pressure of both legs here, working short on this side, long on this side, keeping those toes pulled up and knee locked on the left. And then on the exhale, coming down nice and slow. And so you'll do 3 rounds of those, 3 to 5 breaths per round. Okay, so this next exercise is for hip flexion and internal rotation. So basically we're going to be in the same position as we are for the extension exercise, but this time we're just going to lift legs off the ground. So we're going to start. We'll start with the right leg up this time, and we'll focus on the left here. We're going to try to get a little bit of tuck at the pelvis, so try to put your low back towards the floor, engaging the abdominals here. We'll take a big deep breath in. You're going to pull the toes up, focus on locking out the knee, and then I want you to go get a lift from a deadlift, right? So it's very easy to kind of throw the leg up, capture it, and then bring the leg up here. But I really want you to focus on what it means to actually kind of stabilize by pressing through the right leg here and then slow lifting that very heavy limb off the ground and then controlling it all the way up. There's going to be a tendency for the foot or the femur to want to rotate out like this, right? We don't want that. We actually want to bias just a little bit of internal rotation so that we're really focusing kind of on that midline activation and then getting all the way to the top here, wherever your top is at. Once you get there, you're going to pull those toes down, really feel that quad activate, and then you're going to work against that tension of the hamstrings till you get just that little bit of shake in that leg. Hold for 3, 2, 1, and then you're going to come down nice and slow. So really working this eccentric control. We're not going to let that pelvis dump. You're holding that abdominal activation, maybe even that gentle pressure down through the right leg. As you get low here, you want to really control that soft landing. So it's nice and quiet. Okay, so we'll do that again. Take a breath in, tuck, press, toes, quad, slow lift. Really working at the dead weight of that leg there. All right, this is the hardest range as far as just getting control of the space. A little pressure down through that right here to help stabilize that pelvis as we pull up. A little internal rotation or twisting in. Check the foot, make sure we're not kind of like, moving the ankle around at all, but actually just trying to get nice even dorsiflexion all the way to the top. And then you're squeezing, pulling those toes down, and really working against the tension of those hamstrings, finding that little bit of shake in that space. 3, 2, 1, and then parachuting back down. Nice and slow, and soft landing. Good. We'll get one more on this side. Breath in, tuck, press, right, and then slow lift. Really feel that midline working to control the femur as we get up into the sky here. Trying to control that whole range. Keep those toes pulled down. Keep that knee locked. Fight against that hamstring. 3, 2, 1, and then coming down nice and slow. Focusing on keeping that little bit of internal rotation. That helps us bias that inside thigh. And soft landing. Good. Right. And then we'll just do it 3 times on the other side. So, same situation, press down with the left leg, tuck the pelvis, toes up, knee locked, slow lift. Lots of control coming up. Putting your attention to that midline of the body, trying to feel that inside thigh, working and stabilizing all the way to the top, whatever that is. Once you find that tension, pull those toes down and squeeze that leg towards you. 3, 2, 1, and then parachute back down. Keeping those abdominals engaged, keeping that rotation. Soft landing. Also good exercise for the body, proprioceptive where the ground is. Breathe in, slow lift. Really focusing on that midline activation. So the medial quad, the pectineus, adductors, and then find that edge. Squeeze. 3, 2, 1, and then controlling down. Keeping that abdominal engagement, stabilizing that pelvis by pressing down through that left leg. Soft landing. And last one, breathe in. Tuck and controlled lift off. Pressing down through that left leg to aid in that pelvic stabilization. Working, trying to maintain as much control through that lift as possible. And feeling that sensation on that midline. Find the edge, squeeze. 3, 2, 1. Parachuting down. And soften. Good. The goal for that would be to do that for 2 rounds, 3 to 5 reps per rounds to start. All right, so this last exercise here is the extension work against the wall. So we're going to come down into a sideline position. So you can just support your head here if you want, or you could get a block to support your head here. You want to be leaning or lying just far enough away from the wall to where you can get this foot connected, not out or down, but just straight back into this. If you need the extra support, you can bend the down knee to try to stabilize there. If you want a little bit of extra added effort, you can try and keep that leg straight and then work on keeping that pelvic tuck. Let's go with the bent knee version for now. So knee is bent here. We're just kind of in this little split stance, almost like a sideline 90-90. And you're working on trying to tuck that pelvis underneath you. That's going to get the glute engagement here. And then now we're just trying to press the foot into the wall. So that's going to engage those hamstrings as well. Now you're going to really want to focus on where you feel the pressure in your feet, right? Because you want to feel it from the ball of the foot just to the outer edge. So that makes sure that we're getting the inside to the lateral edge of that leg. And then we're just going to hold that squeeze here. Nice big deep breaths for 5. Focusing on tucking that pelvis. Keep making adjustments. For cramps, try to work through it. Keep focusing on where you're feeling the sensations. One more. And then soften it out. Good. So you can alternate sides here, back and forth in between, or you could do another round on this leg, depending on how you're feeling. We'll alternate sides for the example. So we're just going to switch around, finding that same position, checking in to make sure that we're not overextending or tilting the pelvis forward to try to get that leg behind us, but that we're just in line enough to where we can look down and see pelvis, knee, and then the leg comes back, and then we check to make sure that we're at the right height and just nice alignment with that knee right there, lifting up just a little bit, and then we're pressing down through here. So similar situation, just find that little bit of tuck, glute engagement, start to press back, focusing on feeling the connection to the ball of the foot, just to the edge of the lateral foot here, and then we're going to hold those breaths, really focusing on this posterior chain activation. Good, breathe in. Again, making those minor adjustments of activation wherever you feel it. If it feels like it's going to cramp, try to breathe through that. Keep focused on tucking that pelvis. Keep the squeeze. Try to get both sides of the hamstrings to activate. Last breath. And soften. And relax. Coming down. And like I said, you can just keep switching back and forth between sides, or you can work on one side at a time. But you want to try to get in 2 to 3 rounds, 5 breaths per round.